I'm Dr. Habeeb Muhammad Yakub. I'm the head of Radiotherapy department at the Lagos University Teaching Hospital. I'm also the lead oncologist in NSIA LUTH Cancer Center. The topic for today is cancer, how we increase the chance of success of treatment of cancer. Cancer is a major health disease, and because there's a surge of cancer worldwide. Unfortunately, the developed world has been able to stem the incidence of cancer. However, the low and medium income country, in which Nigeria is one of them, has been unable to stem the rise of the incidence of cancer. And this is a concern to everyone, because cancer basically affects more of the workforce population, and this has major impact in the country. Breast cancer is the most common cancer in women. Cervical cancer used to be the most common in women. However, breast cancer overtook cervical cancer a few decades ago. Cervical cancer is still very common in some rural areas in the country. Prostate cancer is the most common cancer in Nigerian men, and prostate cancer is also the commonest in males worldwide. Lung cancer, as you will see from data, is also very common worldwide. However, that is not the case in Nigeria. We see lung cancer in Nigeria, however, but it's not as common as reported elsewhere. Cancer generally, as we know, is a disease that when the news is broken, it causes a lot of grief. Cancer can be cured only when it is detected early, hence the need for screening. Be it breast cancer, cervical cancer, or prostate cancer, when detected very early, the prognosis, whereas the outcome following treatment, is good. The prognosis is only bad when patient presents late. So what is involved in screening for this cancer? For breast cancer, there are three major modes of screening. One is self-examination. We call it breast self-examination, where the lady examines her breast at a particular time during her period, during the menstrual cycle rather, and for postmenopausal, those who are no longer menstruating, they can do it anytime. It involves using the right hand to palpate the left breast and also the armpit, and using the left hand to palpate the right breast and the armpit. This is usually done for premenopausal women at the 10th day of their menstrual cycle. The second type of screening for breast cancer is what we call clinical breast examination. This involves the lady seeing a clinician, be it a trained matron, a trained nurse, or a medical doctor, to do the examination. This is done occasionally, even if you are doing breast self-examination maybe once in 6 months or once in a year, because the trained hand is likely to detect, it will be more accurate in the detection than the untrained hand. The third mode of screening for breast cancer is imaging, where you do either ultrasound scan of the breast or mammogram. Ultrasound scan of the breast is often done for younger women who are younger than 40 years, while mammogram is usually reserved for women that are older than 40 years or that are postmenopausal. For cervix, what we normally do is what we call it pap smear. Pap smear is very common, and that is usually done for cervical cancer. There are other forms of screening for cervical cancer that are just similar to pap smear. Prostate cancer also has screening methods. There are three major ways of screening for prostate cancer, just like the breast. We have the first one that you use, the tumor marker. A tumor marker is a chemical that goes up when there is tumor in the system, especially when there is a cancerous tumor. The tumor marker is raised in the blood. So for men above age of 40, it's good to at least once in a year go and do your PSA. PSA involves taking your blood sample and analyzing the prostate-specific antigen, which is called PSA level in the blood. Usually, if it is high, it is repeated in a few weeks to see if it is still persist. There are other diseases, there are other factors that can raise the PSA, like inflammation of the prostate, or any activity that massages the prostate, or prostate infection. However, most of the time, if it is cancerous, the level of the PSA is much higher than for other factors. Another way you can screen for prostate cancer is what we call digital rectal examination, where a clinician inserts his hand through the inner vag to palpate or to look at the texture of the prostate. Usually the prostate is smooth. If it touches the prostate and it is craggy, you know that it's most likely you need to do further tests to know if it's prostate cancer. The third one is to do an imaging of the prostate. That's, you do the imaging of the pelvis and you see the architecture of the prostate. Imaging could be CT scan, could be MRI to view the prostate. For these three most common conditions that make up to 40% of all cancers we see in this part of the world, you need biopsy for final confirmation of cancer. And biopsy involves taking sample to the lab to check what is there. Biopsy could be FNAC, it could be other type of biopsy. Treatment. For treatment, we have to look for the type of cancer that the patient has. For example, you have different type of breast cancer, you have different type of cervical cancer, and you can have different type of prostate cancer. So we need to see what's the type that the patient has, and we also need to know what we call the grade and the stage of the cancer. Grade has to do with how active or how virulent, how virulent the cancer is, while stage is how much the cancer has spread. The more we delay before we come to the hospital or before you present for treatment, usually the higher the stage, because the more the cancer spread. It doesn't wait. The important thing to note is that early stage cancer are curable, while late stage cancer are usually not curable. That is, if the right mode of treatment is implemented. So, where do we now get the right mode of treatment? We know that cancer facilities are not very common in Nigeria. We have a few cancer facilities. One of the common cancer facilities in Nigeria is the NSIA LUTH Cancer Center. The NSIA LUTH Cancer Center was inaugurated in 2019 by His Excellency, the President of this nation, General Muhammad Buhari. And since that time, NSIA has been in the forefront of cancer treatment. NSIA LUTH Cancer Center is the most equipped cancer center in West Africa, and they are doing, we operate systems that are not operated in any other part of this country. NSIA LUTH Cancer Center has treated up to 6,000 patients from the inception in 2019, and we are still building our capacity. We are increasing in the different mode of modalities. NSIA LUTH Cancer has treated many people and many patients, and we have had very good outcome. In the NSIA LUTH Cancer Center, we offer radiotherapy in teletherapy, in brachytherapy, that's both external beam and internal beam radiation. We do chemotherapy, we do hormonal therapy, and we also do targeted therapy. NSIA LUTH Cancer Center also offer auxiliary services when required. We bring in experts that we don't have, to do multidisciplinary team approach to treatment. So we give a comprehensive treatment to patients at NSIA Cancer Center. So the key, the word I'm telling you, the take home here is that everyone should imbibe screening. Because if you screen and if you are detected, if there's cancer, then there's almost guarantee that there will be a cure if it is detected early, especially if you go to a very good center, a reputable center like NSIA Cancer Center, LUTH. Thank you for listening.